So what was the main problem you were having when your back was hurting? You went to the doctor, they did an MRI, what did they find?
They found out I had a bulged disc, and then I was having pain down my leg also.
Okay, which leg?
Left leg.
How far down the leg was it going?
All the way to my knee.
Okay, and how often was that happening? Frequently, intermittently?
Frequently.
Okay. How severe was the pain when you were having it? Like 1 to 10, 10 being severe, 1 being minimal? How would you rate that?
I'll go 9 to 10 every time.
So you were living with that for how long?
I'd say a year and a half.
Okay. So where did you go to try and get this cleared up?
Well, I went to my trainers. I went to...
At your college?
At my college. And then I did acupuncture.
Okay.
Tried to get a massage. I did a lot of physical therapy.
Okay. What do you remember what you were doing in physical therapy? Specifically?
Stem and ice.
Electric stem and ice?
Electric stem and ice.
Okay. And how did you, every day?
Yeah.
How did that feel? Did that help you feel better?
It didn't help me. It didn't get me better at all.
Okay. What else did they do? Anything?
Just a little bit of stretching. Try to get back stabilization, but that didn't really.
Okay. What did they have you do? What kind of movements did they have you do when you were doing that?
Just stretching, a little bit of stretching.
Okay.
With weighted stuff, like just laying on your back, laying on your stomach, and going like this.
Okay. Did they have you do any specific lower back exercises?
No.
Okay. Did they have you doing any abdominal exercises?
No.
Okay. So how long did you go through physical therapy?
5 months.
And at the end of it, if you were at a 9 or a 10 on your pain level, where were you pain level wise on that scale after the 5 months of physical therapy?
Probably 9 or a 10.
Okay, so basically no change.
No, it didn't change.
So do you have any pain now?
No.
How long have you not had any pain?
Almost 2 years.
Okay. Now, let's be honest, this wasn't really easy though.
It was pure hell.
But it worked, yes?
Yes.
Okay, so was it the hardest thing you have ever done physically, would you say?
Physically, absolutely.
How long did you go through this program that was pure hell?
Pure hell, probably 4 or 5 months.
Okay. So roughly about the same amount of time you went to physical therapy. So, end result, if you knew then what you know now, what would you do first?
I would have gone to the POWERCORE.
Okay, so, for people that have had a similar circumstance or are in a similar situation and they went all these places and they haven't had any success, just from your experience and knowing what you know, having gone through it, would you recommend this to other people that have the problem?
I completely recommend it. You're going to be very happy when you're done.
Okay. Now, how about like athletes who just love that kind of torturous training and workout and, you know, Bruce Lee style? Would you think they'd like it?
I think they would love it.
First of all, could you even describe the training program you went through?
No. I don't even know how to describe it.
Okay. Fair enough. We'll leave it at that. Describe a little bit about the range of motion movements and the flexibility training.
My hips were very stiff, so we did a lot of kinesthetic, where we did a lot of kicks and stuff to improve the flexibility of my hamstrings, and did a lot of stuff for the hips, walk through and stuff that'll just improve the flexibility, which would then help.
Okay. Now when you say the walkthrough, is that like some stretch that you do?
Walk through, yes.
Okay. Now, is that a stretch that you see people doing a lot?
No.
Have you ever seen it done before?
No.
So it's not a normal stretch you see people doing?
No.
Okay. Was it effective? Do you like doing that?
Yes, I do.
Let's get into the neck training. What was that like? How would you describe restructuring your neck?
It feels a lot better. I mean, it just helps improve, even if I did have any back pain, it helps improve that. And it even does help me in my sports as well, because I'm getting that curve in my neck that I'm supposed to have. After, I feel great. My back, even if it was a little stiff, because I just woke up a little while ago, so I feel stiff in the morning, but I feel great and ready to go run a mile.
Okay.
Miles afterwards.
So it makes you feel better?
Yeah.
Okay.
It's a lot better.
So he's doing the sit-up. You can see that the glutes are on the pad of the POWERCORE XL 1000. He's holding the chest piece to his chest. And this way he's keeping the fifth lumbar seated, and he's extending the thoracic over the concavity of the POWERCORE XL. Increase the cervical lordosis in the neck. He's primarily using the sternocleidomastoid muscle to do this movement. He keeps his hands on the machine to stabilize the face piece, which fits and feels a lot like a catcher's mask, other than it's not wrapped all the way around the head. He's using a cylindrical fulcrum or support that's placed at the apex of the C5, C6 interspace, or the cervical stress line. And as you can see, he's going back into full extension, and then comes to what we consider to be neutral or full flexion in this case. And he'll normally perform 100 reps at 40 to 50 pounds on this. Now this is the pelvic tilt on the POWERCORE XL 1000. It doesn't look like it's a big move. What we're doing is we're seating the fifth lumbar mechanically into position. This movement actually causes shear, and this is constructive shear, not negative shear. And in that term I mean it's actually good for the body, because it's putting the fifth lumbar back into alignment when it shifts out of place. The lower four heads of the abdominals are being used here, and to actually increase the extension of the hips and start utilizing those a little bit more, let's have you put your feet together and bring your knees out just a little bit. Okay, so the glutes remain down, the knees are out. Now, do you feel this more in your hips?
Yes. So
would you consider this be a good thing to do in conjunction with stretching your hips out?
Yeah.
Does it feel good?
No.
Okay, end of question. But does it work?
Yes.
There you go.
I found out from a guy that used to play baseball. He told me that he knew you from a training center, and I came to you and you told me that I needed to work on this, and you guaranteed me I'd feel better.
I did that?
Yeah.
Oh, I did, didn't I? Okay. So did that guarantee hold out?
Yeah.
Okay. Now, have you seen this done anywhere else, or you been around anybody else that's doing this?
No.
Have you ever heard about it prior to us working together?
No.
Okay. Does that kind of surprise you, knowing that this now is available, people can improve, and yet you never heard anything about it?
It's definitely surprising, because you can get so much better. I mean, you can gain so much more strength and stability, especially in your back and core.
Okay. Now, what's the most important thing in life?
God.
There you go. All right, bro. Thanks, man.